So the location in the gastrointestinal tract, we are going to look at it under 9 quadrants. Very often when you go after your second year to the clinics, you will be asked about various organ, in which quadrant of the abdomen is it seen. So you will have to remember how these various organs are placed in the different quadrants. I would recommend you to draw along with me while you listen to this class. So first of all, we have the neck, the upper limb, we have the thorax and the abdomen. Now here you know that you have the sternum, and we have the xiphoid process. On either side, what we are seeing here, this would be the costal margin, and here, right here, we see the symphysis pubis. Okay, so this is a general outline. If you get any viscera, if you want to say about the location, the first thing you would have to draw is this diagram. It just took hardly a few seconds. Now in this diagram, there are a few planes which we have to see. One is the transpyloric plane and one is the transtubercular plane. These are the two horizontal planes. We also have two vertical planes. This is the left lateral and the right lateral plane. Okay. In one of the question papers that came recently, the university question papers, one question for a 3 marker or a 5 marker, I believe it was transpyloric plane. Just one plane along this diagram was asked. So please remember that it is quite important. Now, how are we going to draw these planes? The transpyloric plane would be drawn somewhere around here. If you want me to define it, I would say that it would be around midway between the suprasternal notch and the symphysis pubis. If you can say, it is almost midline between that. Or you could also say that if you have the umbilicus here, it is midway between the xiphoid process and the umbilicus. Or you could also say it is a hand breadth below the xiphoid process. At that level, you are going to draw a horizontal plane. Now that is your transpyloric plane. Transpyloric. Now when you say transpyloric, it means that it is going to pass somewhere through something that is called as pyloric. Now what is this pylorus? We'll be seeing about that. Okay, so anyway, you have seen the 3 ways in which you can define this plane. One was midway between the suprasternal notch and symphysis pubis. One was between the symphysternal joint, the umbilicus, midway between that, and another one was a hand breadth below the xiphoid process. So at this level, we are going to draw a horizontal plane. That is your transpyloric plane. Now, these were 3 bony landmarks, 3 ways in which we could get this plane. But other than that, there are some other things that we have to notice. It is crossing the subcostal margin here. So where does it cross the subcostal margin? That is at the tip of the 9th costal cartilage, which should come somewhere around here. This would be the 9th costal cartilage and this would be the 9th rib. So you are seeing that at the tip of the 9th costal cartilage also it passes. Now on the posterior aspect, the vertebral aspect, which is very often the plane by which you are going to mention many of the levels of various viscera. If you are asking about the vertebral level, I would have to tell you it is at the lower border of L1 vertebrae. Okay, so I hope you're clear about this transpyloric plane. Now what are the changes that occur in this transpyloric plane? Why I'm mentioning about this is because it has come as a separate question. So we have the pylorus, that is the last part of the stomach. It will be passing through this. Then what else do we have? We have the kidneys, the hilum of the kidneys. Those will also be at the level of the transpyloric plane. Then you could see the gallbladder also would be seen at that same plane. So there are various structures which are seen at the transpyloric plane. So you have to remember about this. Now what is the second horizontal plane? The second one is another plane which is called as, this was transpyloric, this is transtubercular. Now transtubercular means it's passing through some tubercle. Now what is that tubercle? At the iliac crest, you have a tubercle. If you remember your osteology classes, there was a tubercle there called as a iliac tubercle. Now this plane passes through the tubercle of the iliac crest. This is the transtubercular plane. So these are the two horizontal planes. Now what are the vertical planes? One is the left and the right lateral planes. Now what does it pass through? You just have to remember, if you remember, there was a mid-clavicular point and you also had a mid-inguinal point. So this plane is going to pass through both of these, the mid-clavicular point above and the mid-inguinal point below. So this is your left lateral plane and this is your right lateral plane. I hope you're clear with this diagram. Okay, now that we have drawn all these planes, let us see how it is divided. We have mainly 9 quadrants here. Okay, and here I'm just going to show you how the diaphragm is going to be represented here. This is the diaphragm. So actually below the diaphragm you have the abdominal cavity. So what are these planes? Just this is the umbilicus, so you can call this is a umbilical region. Now this one above this you call it as the epigastric region, below it you are going to call it as the hypogastric region. So you have the umbilical region, then you have the epigastric region, then you have below you will be having the hypogastric, below the gastric. So you have it hypo means always below or less, hypogastric region. Now these are the 3 regions which are seen in the middle. How about on the lateral aspect? Now this you can see it is just below the costal cartilages. You remember that chondra is something related to cartilage. So when you're saying it is below the chondra, below the cartilage, you're going to call it as hypochondral, and depending on which side, if this is a right, you call it right hypochondral and this is a left hypochondral region. That's very simple to remember that. Now if you remember what are the organs here, and these 2 organs, the very important vital organs on both sides, those are the kidneys, and the kidney we know it is in the lumbar region. So you're going to call this as a right lumbar region, and this is called as a left lumbar region. Now how about below that? Below that also you have 2 quadrants on either side. This is called as a right iliac region and this is a left iliac region. So I hope you're clear with all these 9 quadrants. Now if you are asked whether it be an essay or a short note or any question, if you are asked location, I would advise you to be ready with this diagram. You can draw it within, it just takes hardly a minute, and drawing this diagram you can draw the organ, where is it located in which quadrant.